Hi, Dr. Michael Miyazaki here, and I'm just going to talk to you a little bit about Htic Agents. I have talked about it before, so if you haven't seen some of the other videos, go back and watch them. But the two choices that we have typically are going to be one that's a clear, some kind of aluminum chloride-based Htic agent, and then the brown ferric type. And I know in the past, I really loved anything that was more ferric based, because if I use a Htic agent, I just wanted to stop the bleeding and work, and I wouldn't have to worry about it. So I always used something that was ferric based, and I haven't used a ferric based Htic agent in years. The reason why is because I switched over to QuickStat Free, which is a aluminum chloride based Htic agent that just works. You know, I get down into an area where maybe we started in where the gums weren't healthy, or I have to go chase decay and I get deeper and deeper and deeper, and I'm subgingival and all this red stuff starts to come up. What I've found works really well in our office is I just take the QuickStat Free and I apply it to that tissue area and rinse it off, and I've got a nice clear area in which to work. So for the last couple of years, I've migrated, like a bird, I guess, away from the brown Htic agents to the more clear-based. Whereas before, I just never thought anything that was clear was ever very effective, so I stayed away. Well, last week I had a patient that came in, and we were working on an upper central, and I'll show you some pictures here. It was a crown, and this tooth had had a root canal and a post-core, and she came in saying the crown was loose. And sure enough, I could wiggle it a little bit, but I really couldn't get it off of the root. So we had her come in, and we delicately, I came in from the lingual side, and I loosened the core buildup in the crown by coming in from the lingual. So I came in from the lingual, got rid of all the porcelain on the lingual side. Then I took a really fine diamond burr and I went between the core buildup, the post, and the outer porcelain. Why was I doing that? Because one of the hardest things for me to do is to match a single unit anterior veneer crown, you know, a single restoration. So I wanted to save that crown so I could send it to lab to match the color. I had talked to the patient about doing both centrals, although only one for a clinical reason had to be done, but for aesthetics I was trying to get her to do two. And then on that day I said, hey, I think I can dissect this crown off, keep most of the facial porcelain, have the lab match it, because we use a really good lab here close to our office, and we can probably get away with this. So I did that, but as I was cleaning the tooth out, we were subgingival and the tissues were just bleeding. And so I had this sea of red. And I thought, okay, I'm going to use my clear. So I did use the clear, and it stopped the bleeding and looked really good. But I was kind of curious about how that would differ from the ferric-based Htic agent. So I got in there, had to refine the preparation, and as I was refining the preparation, the bleeding kind of started again. So again, I did my rough prep, used a clear Htic agent to stop the bleeding so I could see the margins and kind of refine them. Then I got in there with my ferric just because I wanted to see if the ferric was as effective as my clear. I use the Stat Flow tips, which are really nice tips. They fit on both syringes of the QuickStat Free and the QuickStat Gel. And so it has a really nice soft delivery. So I just put this tip onto the syringes, and I just apply it to that tissue where I have that sea of red. Well, needless to say, if the clear one stopped the bleeding, then the brown one was probably going to do the same job. So I used the ferric-based QuickStat Gel, which is 20% ferric sulfate, and it did a good job. So I got my scan, I got my intral impression done, and then I made the temporaries. And because I haven't used the ferric base for a long time, I was concerned about the dark appearance of the tissue, so we used some peroxide to remove all that. But I made the temporaries, and I think we used a A1 shaded temporary, so it's fairly light. And what I saw was that darkness at the gum line that whenever you use something that's ferric based, you're typically going to end up with. And even though I went back in there and I used some peroxide to get rid of that brown, it was still there. So what did I learn? I'm still most likely always going to stick with my clear. Remember, Quickstat Free isn't just aluminum chloride. It's got a special sauce, and that is it has some magnesium added to it and those really tricky surfactants. And those surfactants allow our aluminum chloride and the magnesium to stop the bleeding because they can penetrate those broken blood vessels much easier. So I don't like to have my brown temporaries. I'm going to go Quickstat Free. And if you haven't used Quickstat Free, I would encourage you. It still blows me away that it works so well. We deal with tissue all day long, and we see that red coming up. Sometimes even when I'm doing a direct composite restoration, we get in there, we're prepping out a box or a class 5 area, and we're right by the gum, and we get that red. Well, again, if I'm going to place my composite, let's say it's a class 5 on an upper central, I don't want that brown stain to be there when I'm done. So again, I just stop the bleeding with my Quickstat Free. Been talking about it for many years now. Quickstat Free is my go-to solution. What I'd love for you to do is give it a try. Let me know how it works out for you. That's it. Thanks. If you like this, give the tip a try. Subscribe. Share this information if you find that the Quickstat Free works well for you. And we are developing this community of like-minded individuals, clinicians that like things that work. And we take responsibility for our patients' health, and I think that's really important today in the dental profession, that we take responsibility and we work with the patients to help them be successful. So hit the like button, and I look forward to seeing you again soon. Thank you very much.